why do we build these population cohorts? Let's just get started. So we like to think of these population cohorts as population laboratories. We're using the population as a way of studying who develops diseases, what factors contribute to disease, and it's very different than, if you like, a clinical cohort. Clinical cohort usually consists of participants who are coming to a hospital. Maybe it's a cardiovascular hospital, maybe it's a cancer research center or something like that, because they have a specific condition. What we're trying to do with these population cohorts is capture lots and lots of information before you develop a disease. Now, that does not mean that with these population cohorts or these population laboratories that we don't bring in participants who have been diagnosed with the disease. We do. But what I'm trying to emphasize is we are trying to get a snapshot off the population when we build these population cohorts. And I'll give you some indications of why that's important for research. Now, this next slide I usually use is a bit of a straw man. It's a bit perhaps unfair to Andre Picard, because this article came out in the Globe in 2016, and he was making a case, and I think a very good case, for why we need to have population cohorts in Canada, right? And in major activities across the planet have put substantial investment into building the types of population cohorts that I'll be describing today. The UK Biobank is perhaps one of the most important health studies on the planet, because they've made significant investments into building population cohorts to study the development as well as the underpinnings of disease. They've recruited 500,000 people. Australia's followed suit. The All of Us program in the United States is following suit. They're a little bit behind us here in Canada, so we're actually part of this community now. The US program will be recruiting 1 million people over the next number of years, and they've already started doing genome sequencing on those participants. So this type of activity is not necessarily unique to Canada, but we have some aspects because Canada is a unique population with a unique environment and a unique ethnographic distribution as well. So we need to have our own population cohort. And this is the name of the population cohort. It's called the Canadian Partnership for Tomorrow Project. It is a population health research platform. We do not just support population health research, we support broad areas of research, but because it is population-based, we call it a population health research platform. 6 cohorts, the Atlantic provinces were all put into one activity, so all 4 provinces there are part of the activity. Manitoba, as I may have mentioned, just came online, so we've just begun our recruitment activities there. And you're seeing the names here of these population cohorts here. So Manitoba, I'm highlighting them because we're helping to get them out of the door. And these are, as I mentioned before, the regional activities that we have supporting the CPTP, or the Canadian Partnership. As was mentioned during the introduction, I was the leader of the Cardigan activity for many years, so I was involved in the recruitment of the 40,000 participants that were consented and recruited from 2009 to 2015. I'm now leading the Ontario Health Study as well as leading the National Scientific activity as well.